Hi everyone! We are all aware that COVID cases are increasing again, but just because you don't feel well, it doesn't mean that you have the coronavirus. If you are sneezing, have a runny nose, and a headache, you may be sick, but it's probably the common cold that you would get at this time of the year. You should keep an eye on your condition, but don't panic. It is important to know the symptoms. 90% of people with COVID have a fever, 70% have a dry cough, 30% have trouble in breathing, and runny noses are only found 4% of the cases. For this video, I will be answering the question, what is the difference between the cold, flu, allergies, or COVID-19? So here's the information to help you better understand its differences. But first, let's define the following. Number 1, common cold. Common cold is a viral infection of your throat and nose, or your upper respiratory tract. The symptoms are generally mild compared to the more aggressive viruses like the flu. A typical cold will last on average 7 to 10 days. Seasonal influenza or flu is still active, and generally it comes on fast and furious. It's a common respiratory infection of your throat, nose, and lungs, and it will last 5 to 7 days. Seasonal allergies are very common to those countries who experience spring, especially when the snow started to melt. You can have runny nose or itchy eyes. It's possible that you might have cold, but it could be also a seasonal allergy. The most common allergy is coming from pollens, dust mites, or pet danders, yung sa mga balahibo ng pusa at aso. COVID-19 is a new strain of coronavirus, not previously seen in humans, but spreading quickly worldwide. It causes respiratory tract infection, either upper respiratory tract like your nose, throat, or your lower respiratory tract like your windpipe and your lungs. So COVID-19, flu, cold, or seasonal allergies, how to tell the difference? So for the onset symptoms, meaning gaano ba kabilis ka mahawaan? For COVID-19, it's 2 to 14 days after exposure. So medyo matatagalan pa. For influenza or flu, it's abrupt, meaning mabilis. For cold, gradual, meaning hindi mabilisan. Dahan-dahan mafe-feel mo yung symptoms. For seasonal allergies, it depends on the environment. From the table, we will see if symptoms occurs often or madalas, sometimes or minsan, and rare or bihira. So from that table of symptoms, you can actually identify whether you experience COVID-19, influenza or flu, or is it only a cold or seasonal allergies. In my case, unfortunately, I experienced all those symptoms, and it took 2 to 3 weeks for me to fully recover. You may not experience all the symptoms, but you need to be cautious enough, especially if you're with someone who is infected with COVID. And if you're not really sure, better to get the PCR test if necessary. However, don't forget to follow all the precautionary measures, stay healthy, and of course, keep safe. Bye everyone!